And I'm seeing this over here. So now I have possible likely pneumatosis. I have portal venous gas, so I'm probably going to upgrade in my mind to... Hi, I'm Dr. Mason Vaillancourt, a PGY for radiology resident. I'm going to walk through one of Zauron's radiology cases with you today. Check the link in the description below and follow along live with me. Let's go. Here we have a single radiograph view of an infant. The indication is catheter positioning in a patient setting of prematurity. This is a very common study for radiologists to review, whether it's daily positioning checks or initial placement. So in that line, I see an umbilical venous catheter coursing along the right side of the patient's body with tip terminating at this inferior cava atrial junction. I'm happy with that position. I'm happy it's not turning into a hepatic vein. I also see an enteric tube, presumably an orogastric tube, coming down with its tip and side holes in the gastric body. All this is well and good, but we also need to treat this as a general radiograph to review. I look at my chest, and while not well zoomed in on, not focused on, I'm not seeing any new focal opacities, presumably new focal opacities. Continue to my abdomen, and I want to look at my bowel gas pattern. My stomach's a little full, a little more air. And as I get into the rest of this bowel, I'm really trying to look for evidence of free air, portal venous gas, and pneumatosis, all things that might be seen in a premature infant who maybe is having necrotizing enterocolitis or NEC. So as I zoom in here, and I'm evaluating the bowel, I want to try and get myself a nice optimal view to show it off. I like to kind of work my way in a little bit of a circle pattern and do a couple laps around the bowel, so I kind of work symmetrically on out. Knowing that my small bowel tends to be more central, large bowel more on the periphery. It's always hard to tell in babies who don't have full development of the mucosal folds here. And I'm pretty happy with how things look. I see some preperitoneal fat over here. As I get over here, though, there's some kind of bubbly lucencies in this portion of bowel in the right hemiabdomen. And while this portion here doesn't necessarily get me concerned, I really don't like, as I kind of look at this a little more closely, I'm going to try and get a good window on it here. I really don't like this kind of linear decreased density here. It reminds me of air that could be infiltrating into the bowel wall. So this to me is suspicious for pneumatosis, which kind of makes all this a little bit more suspicious for pneumatosis and not just some admixed stool, which would be, kind of quite a lot, especially at this age of prematurity. But this kind of additional finding, maybe now these kind of circular lucencies down here, make me a little more worried. So I want to look for my other signs. I want to look for pneumoperitoneum. Ideally, I'd have a lateral view, which I don't have here, and that's okay. But I want to go look up for portal venous gas. And this is one that's very easy to miss, but I'm looking for branching linear hypodensities in the liver parenchyma. And sure enough, I should not see these. And I'm seeing this over here. So now I have possible likely pneumatosis. I have portal venous gas, so I'm probably going to upgrade in my mind to this is definitely pneumatosis. And as I try and get an assessment for free air in general, it's a little hard. Is there increased overall lucency shading over here that if this baby's rotate a little bit in such a way that there's a little pocket of air that might be sitting here? Sure. But I'm not seeing a full falciform ligament sign or football sign. This patient's, I'm not seeing definite frank pneumoperitoneum, but in the setting of pneumatosis, in the setting of portal venous gas, I definitely want to be talking with the clinician, seeing if there's any abdominal distension, if there's any new clinical findings, blood in the stool, feeding intolerance, things of that nature. So using Zauron's flags here, we do see that area of pneumatosis in the portal venous gas. But we also see that they're marking an incidental fracture, which sure enough, we come up here to the left humerus, and we see this kind of minimally displaced fracture. Once again, always a good reminder that for all our pediatric patients, we get a wider field of view, and that there's some bones for us to assess. So here we see this fracture, which is important to call out because we want to know, is it new or not? Is it something acquired in the hospital? Is it something that we have from birth trauma? Very important to pay attention to this because it also might rule in our suspicion for other conditions such as osteogenesis imperfecta that may predispose this patient to fracture. So we check everything on our studies. Thanks for joining me for this teaching file. Now that we've gone through all the toggles, hopefully the abnormalities are a bit clearer. See if you can identify this abnormality in Zauron's companion cases and sign up for Zauron CME at zauronlabs.com/guardianlight. Study on.